You've been directed to this video because you have a Contour Plus glucose monitoring meter. We will demonstrate how to use your blood glucose meter here. Remember to wash your hands with soap and water and then dry thoroughly before testing, as unclean hands can affect your test results. So let's get started. The content of this video is put forth as entertainment purposes only, and this creator makes no claims, promises or guarantees about the accuracy, completeness or adequacy of the procedures and instructions contained therein. The creator of this content expressly disclaims liability for errors and omissions that any viewers of this video might declare that exist in the information as presented. No liability exists or can be ascribed to this content creator in the event of any accident or injury that might occur as a result of improper application or understanding of the procedures and information contained in this video. We need our Contour Plus machine, our test strips, our Microlet lancing device, a lancet, our sharps box, a tissue, and our instruction manual. This is our instruction manual. So if we look at the section for measuring your blood glucose levels, if we flip to that now, you can see here there are some detailed instructions on how to measure your blood glucose, so please refer to that if you need any further help. First of all, check the strips for your machine, in this case the Contour Plus device. Check the expiry date. Here we have our Microlet lancing device and lancet. We made a separate video with detailed instructions and a demonstration on how to load this device safely and discard the lancet. A link should appear in the top corner now. You can see here the lancing device. Unscrew the end in a clockwise direction. We then remove the cover and then we push the lancet in as far as it can go. We then twist off the protective end of the lancet, which exposes the needle within. Now screw the end of the lancing device back on in an anti-clockwise fashion, lining up the markings on the side. Be careful of the exposed needle. We then take our test strip and insert this into the meter. When we insert the test strip into the meter, it switches on, and you can see here there's a blood drop flashing on the screen, which means it's awaiting your blood sample. When getting ready to lance our finger, please make sure that we've loaded the device. You can load the lancing device by pulling back the plunger. In this instance, we've set the depth of penetration to the number 4. Remember, we'll have washed our hands and dried them prior to testing. We can choose any of the fingers for the procedure. Remember to rub your fingers as shown here. Remember to lance your finger on the outside of the finger and not the finger pad. Place the lancing device against the finger and press the white button. We then squeeze the blood drop from the finger. We then place the meter with the strip against the finger where the blood drop is located. As you can see here, the test strip draws up the blood automatically, and then the meter counts down from 5 to 1. We now have our reading shown on the screen. Take your tissue and hold this between the finger you drew the blood from and your thumb, and vice versa if you drew blood from the thumb. Now we have finished. We discard the test strip safely. We also need to discard the lancet from the lancing device. So unscrew the end of the device in a clockwise direction. This exposes the lancet. Be careful of the needle. You then push the grey slider on the side forward, and this will discharge the lancet into your sharps box safely. Screw the front end of the device back on by lining up the markings and screwing on in an anti-clockwise direction. Once you've done this, store your items and your glucose meter in the wallet which came with the device. Thanks for watching, and I'll see you in the next one.